I have taken the Missouri Comprehensive School Counseling Program class, and as a future school counselor, um, I was familiar with the different program components, the curriculum, which is just the providing counseling in a systemic way, K through 12, the individual student planning, the responsive services, and which um, the responsive services, even after taking the class, leaned more towards the understanding that it was a like more of a um, crisis intervention. But rereading and listening to Dr. Forth's podcast, I realized that it could be something as simple as small group counseling or giving a referral to a parent or a teacher, consultation. So responsive services doesn't necessarily always mean crisis intervention. And then system support, which is just including the program staff and school support activities and services. Um, I did think it was interesting that it was stated in the division of the counselor's time utilizing the school counseling comprehensive program that 100% of the school counselor's time should be devoted to implementation, delivery, and management of the CSCP. Excuse me. Because I know just from working closely with our school counselor, that is not always the case. There are lunch duties and bus duties and just extra coverage that is not related to the comprehensive program model, but does take away from the school counselor's time being able to provide individual student planning and responsive services. What I did find interesting was was hearing in Dr. Forth's podcast about how even the clinical mental health side of counseling also utilizes a comprehensive program, even if it isn't for a school setting, teaching a set curriculum, like she had stated, to a possible addictions group or substance abuse group, where you are actually um, teaching them lessons and providing individual planning, such as giving assessments and giving direct counseling. I think I just assumed that since it was the comprehensive school counseling program, that it was just for school counselors. So I decided to further my thinking with that. And I found an article called The 7 Challenges Comprehensive School Counseling Program, Effectiveness for Adults with Substance Use Problems. It was written by Korchmaras in the Journal of Drug Issues, and this was in October of 2018. And I found it very interesting when it described the 7 Challenges Comprehensive Counseling Program for Clinical Mental Health, and how it was a non-judgmental approach that encourages self-evaluation and focuses on the decision-making process rather than insisting upon a particular behavior. And that there was a quote in there that I really enjoyed and really thought that it really elaborated on the program. So it said that research has shown that the 7 Challenges program, which is a comprehensive model, is effective at addressing substance use related problems and co-occurring problems with adolescents. Data has indicated that it is effective at reducing substance use and related problems. The article went on to discuss how using a comprehensive program with a curriculum such as the 7 Challenges program with substance users and clients of that nature, that teaching them that it's not just about the substance abuse, but that it is also about their environment and how to increase self-help activities and all of the related presenting problems that occur with substance abuse. Just creating an awareness of that and helping them learn about those other presenting problems as well as the substance abuse. It said that it indicated that the program was effective at reducing substance use and related problems in adolescents, and it decreased mental health related problems and increased treatment motivation. So I found that article extremely